It's Thursday afternoon, so let's talk briefly about the approaching tropical system and then get right to COVID, which regrettably is still around in a very big way. So the sixth named storm of the 2021 season, Fred, is currently just off the eastern end of Cuba with maximum sustained winds of 35 miles per hour. Now we are presently in the cone, and although it has weakened as of this morning, it is expected to strengthen somewhat when it goes over the Florida Straits. So our city's Emergency Operations Center is activated to level 2, a monitoring level. Any impacts to our community are expected to be felt overnight tomorrow, Friday, and then through the weekend. So while there are currently no watches or warnings for our county, we are taking proactive steps like deploying portable pumps to low-lying areas of our city. The mantra remains the same. Hope for the best, but prepare for the worst. Now you can stay informed by visiting the National Hurricane Center site for the latest on the storm. And you can also text MB Alert to 888-777 for real-time updates from the city. To report flooding, call our Public Works Control Room at 305-673-7625. Now, let's get to COVID-19, and there are lots of very troubling data points to discuss. First, the state of Florida is by far the national hotspot. Over the last 7 days, we have set numerous one-day records for actual infections in our state, a category where we are leading the nation by a wide margin. Now, with regard to actual deaths, 2 days ago, our 7-day total, according to state data provided to the CDC, was 791, again the most in the country. But yesterday the number plummeted to 216. Now we didn't get better, nor did less people die. Rather, the State Department of Health just decided to delay the way they report deaths to the CDC so that most deaths are now reported well after they happen. So while it looks better on paper, it's not actually better at all. And of course, we are also leading the nation in hospitalizations as well, again, by a very wide margin, which is the very best indicator of how dire things really are. And we are feeling it here in our county and city. In Miami-Dade, there are 1,697 hospitalized due to COVID, with 335 people in the ICU. That is almost 100 more COVID patients in the ICU than in my update last week. At Mount Sinai, our local hospital, yesterday the COVID patient count was 110, with 18 in intensive care, which is double the number from last week. Now, as you can see, the number each day being hospitalized in the county is almost entirely comprised of the unvaccinated. And by the way, for those of you still figuring you're too young or healthy or you already had the virus, so you don't need to bother with the vaccine, the hospitals and ICUs are literally filling up with people who believed exactly the same thing you do. So let's talk about that. Yes, many are understandably frustrated that this entirely avoidable surge is because too many people just didn't get vaccinated. And it does feel like too many, especially too many young people, decided to let everyone else get their shots while they didn't. But notwithstanding this frustration, we can't ignore what we need to do right now. Our City Hall is now requiring masks and working on a requirement for employees to be vaccinated or get tested weekly. And although we cannot mandate local businesses do the same, I urge you to do so if you are in a position to. People should be wearing masks inside, and you should demand your employees get vaccinated. Wearing a mask and getting a vaccine is not a political statement. It's a healthy practice that keeps you, your loved ones, your coworkers, and your neighbors safer. Now, regarding vaccinations, the Department of Health reports that our city's resident vaccination rate is high, and the county is also higher than the state's average. But I am convinced that the Department of Health is including many non-residents in the count, causing the rate to be artificially inflated. That is why so many zip codes in our county including the ones in Miami Beach, reflect well over a 100% resident vaccination rate. Some are even over 200%. Now, the best proof that the state's numbers are unreliable is that according to the state health department, the Dade County residents living in our airport's zip code have over a 3,000% vaccination rate. Obviously, those include mostly vaccine tourists and not our residents. Bottom line is, we can't assume everyone is vaccinated simply because the state health department reports a high rate of vaccinations. Now, last week, our city opened a new walk-up combination site for COVID-19 vaccines and for testing at the parking lot on 17th Street next to our City Hall. Over 1,370 people have been vaccinated there this last week. The line is generally not long, and everyone is very friendly. Please make sure you take advantage of this resource. No appointments are needed, and the site is open every day, 8 a.m. to 5 p.m., with Pfizer and Johnson & Johnson shots available, as well as 24-hour turnaround time on PCR tests and immediate turnaround on antigen tests. Now, there is no charge for either the testing or the vaccines. You will, however, be asked to provide health insurance information. If you don't have health insurance or can't produce it, you will not be turned away. Again, there is no cost. So as always, thank you for your patience and your calm and your sacrifices. Please urge your family, friends, and coworkers to get their shots if they have not yet. And for now, mask up when inside. Stay safe this weekend.